Thank you very much, everybody. And of course, we're delighted to have the Chief Constable with us here today. And first of all, I'd like to start by extending the best wishes of everyone in the Executive to all those battling the effects of COVID-19 in hospital, including, of course, the Prime Minister and indeed Tony Lloyd, MP, who has recently completed his second year as Shadow Secretary of State for Northern Ireland. We know, of course, that it's a time of great worry for all patients and their families, and we wish them all a full and swift recovery. We're also, of course, thinking at this time of all the relatives and friends of victims of COVID-19. The pain of losing a loved one is hard in normal circumstances, but is particularly acute at this time. The Executive will do all that we can to support you in this very difficult period. Deputy First Minister and I have just participated in the latest COBRA meeting, chaired today by the First Secretary, Dominic Grab, and all parts of the United Kingdom can testify to the positive impact that social distancing is having on the challenge that we face. And I want to place on record again how much the Executive is grateful to the brave health workers in our intensive care units and COVID hospitals who are treating patients with the most acute symptoms. We salute you and those who are carrying out the essential testing of NHS workers, those who have come out of retirement to swell NHS ranks, the ancillary staff who are keeping hospitals clean and functioning, the domiciliary and residential care workers who are going above and beyond to protect the vulnerable, the paramedics, the pharmacists, counsellors, GPs and community nurses who provide other essential health services as well. This Executive is working hard to ensure that you are all properly equipped for the fight. We are identifying a range of sources to supplement PPE stocks and secure ventilators. We are examining where delays or other issues have been identified. We hear what people are saying in the provision of PPE, and we take concerns that are raised very seriously. Earlier today, the Finance Minister outlined how 933 million in executive funding is being spent on our COVID-19 response. Almost 300 million was allocated to support the health service, protect the most vulnerable in society and support businesses at this challenging time. That announcement was on top of the 633 million already allocated across departments for crucial interventions ranging from direct payments to families whose children receive free school meals, to business grants, additional resources to prison service, to the ramping up of testing of our NHS staff, and of course the suspension of car parking charges for those staff. The Deputy First Minister and I are also very conscious of the mental health issues which may arise as a result of the coronavirus. We've held discussions with mental health professionals and charities about addressing the needs that exist today and in the medium term as Northern Ireland emerges from this pandemic. And I'm delighted that the £10 million funding for mental health provision arising from the Confidence and Supply Agreement will continue, along with the specific additional spend on social deprivation and improving our broadband infrastructure. So tonight, members of the public will again take to their doorsteps, driveways and gardens to applaud our NHS staff. And while that is to be welcomed, there is another, more effective way you can support our healthcare workers. By staying at home as much as possible, you can play your part in limiting the spread of COVID-19 and easing the pressure on our healthcare staff. And we have asked the Chief Constable to join us today because while the majority of people have done the right thing in recent weeks by staying at home and self-isolating or social distancing, we need to really drive home the message this afternoon that we cannot afford to relax our guard, especially now. Easter, I know, is a special time for families, especially for Christians of all denominations. It's also a bank holiday weekend when people like to relax. But Easter 2020, however, is going to have to be like no other. We cannot behave like we normally do. We cannot interact with relatives and friends as we normally would. Please stay at home. Please do not undertake non-essential travel. Please exercise outdoors once a day, close to home. Please do not travel to beauty spots, no matter how sunny it is. And please follow all public health guidelines on hand washing and on social distancing. because by following that advice, you will relieve the pressure on our health workers and you will save lives at this critical time. There is nothing better that you can do. So this is a difficult time for Northern Ireland, but acting wisely and in the interests of others, we will get through it together. And before I hand over to Michelle, I want to read a little excerpt from a letter that she and I both received today. And it's from Nadine Mitchell, who's a young woman from Ballymena. And here's what she had to say. I'm finding this situation that is going on in the world right now very difficult, as I have autism and other learning difficulties. But knowing that I am saving lives just by staying indoors makes it that little bit more understanding, because the more people that stay indoors are helping stop the spread of COVID-19 and are also helping doctors, nurses, PSNI and other frontline workers. And I couldn't have put it better myself.